Check the vital signs of the patient in preparation to the initial assessment. Apply aseptic technique in hand washing before assessing the patient. Sir, I'm going to do manual muscle testing to you. For me to know your muscle strength so that I could prescribe the appropriate therapeutic exercise for your condition. Thoracic extension. Grade 3, fair. Position of patient. Prone with arms at sides. Position of therapist. Standing at side of table. Lower extremities are stabilized just above the ankles. Test. Patient extends spine, raising body from the table so that the umbilicus clears the table. Instructions to patient. Sir, raise your head, arms, and chest from the table as high as you can. Grading. Grade 3, fair. Patient completes the range of motion. Thoracic extension. Grade 5, normal, and Grade 4, good. Position of patient. Prone with head and upper trunk extending off the table from about the nipple line. Position of therapist. Standing so as to stabilize the lower limbs at the ankle. Test. Patient extends thoracic spine to the horizontal. Instructions to patient. Sir, raise your head, shoulders, and chest to table level. Grading. Grade 5, normal. Patient is able to raise the upper trunk quickly from its forward flexed position to the horizontal, or beyond, with ease and no sign of exertion. Grade 4, good. Patient is able to raise the trunk to the horizontal level but does it somewhat laboriously. Thoracic extension. Grade 2, poor. Grade 1, trace, and Grade 0, 0. These tests are identical to the Grade 3 test except that the examiner must palpate the lumbar and thoracic spine extensor muscle masses adjacent to both sides of the spine. The individual muscles cannot be isolated. Grading. Grade 2, poor. Patient completes partial range of motion. Grade 1, trace. Contractile activity is detectable but no movement. Grade 0, 0. No contractile activity. Thoracic flexion. Grade 3, fair. Position of patient. Supine with arms outstretched in full extension above plane of body. Test. Other than patient's position, all other aspects of the test are the same as for Grade 5. Patient flexes trunk until inferior angles of scapulae are off the table. Position of the outstretched arms neutralizes resistance by bringing the weight of the arms closer to the center of gravity. Instructions to patient. Sir, raise your head, shoulders, and arms off the table. Grading. Grade 3, fair. Patient completes range of motion and flexes trunk until inferior angles of scapulae are off the table. Thoracic flexion. Grade 4, good. Position of patient. Supine with arms crossed over chest. Test. Other than patient's position, all other aspects of the test are the same as for Grade 5. Grading. Grade 4, good. Patient completes range of motion and raises trunk until scapulae are off the table. Resistance of arms is reduced in the cross-chest position. Thoracic flexion. Grade 5, normal. Position of patient. Supine with hands clasped behind head. Position of therapist. Standing at side of table at level of patient's chest to be able to ascertain whether scapulae clear table during test. For a patient with no other muscle weakness, the therapist does not need to touch the patient. If, however, the patient has weak hip flexors, the examiner should stabilize the pelvis by leaning across the patient on the forearms. Test. Patient flexes trunk through range of motion. A curl-up is emphasized, and trunk is curled until scapulae clear table. Instructions to patient. Sir, tuck your chin and bring your head, shoulders, and arms off the table, as in a sit-up. Grading. Grade 5, normal. Patient completes range of motion until inferior angles of scapulae are off the table. Weight of the arms serves as resistance. Thoracic flexion. Grade 2, poor. Grade 1, trace, and Grade 0, 0. Position of patient. Supine with arms at sides. Knees flexed. Position of therapist. Standing at side of table. The hand used for palpation is placed at the midline. of the thorax over the linea alba, and the 4 fingers of both hands are used to palpate the rectus abdominis. Test and instructions to patient. The examiner tests for grades 2, 1, and 0 in a variety of ways to make certain that muscle contractile activity that may be present is not missed. Grading. Sequence 1, head raise. Ask the patient to lift the head from the table. If the scapulae do not clear the table, the grade is too poor. If the patient cannot lift the head, proceed to sequence 2. Grading. Sequence 2, assisted forward lean. The examiner cradles the upper trunk and head off the table, and asks the patient to lean forward. If there is depression of the rib cage, the grade is too poor. If there is no depression of the rib cage but visible or palpable contraction occurs, the grade assigned should be 1 trace. If there is no activity, the grade is 0. Proceed to sequence 3. Grading. Sequence 3, cough. Ask the patient to cough. If the patient can cough to any degree and depression of the rib cage occurs, the grade is too poor. If the patient coughs, regardless of its effectiveness, the abdominal muscles are automatically brought into play. If the patient cannot cough but there is palpable rectus abdominis activity, the grade is 1 trace. Lack of any demonstrable activity is grade 0, 0. Thoracic rotation. Grade 3, fair. Position of patient. Supine with arms outstretched above plane of body. Position of therapist. Standing at patient's waist level. Instructions to patient. Sir, lift your head and shoulders from the table, taking your right elbow toward your left knee, then, lift your head and shoulders from the table, taking your left elbow toward your right knee. Test. The test is done first to the left and then to the right. Grading. Grade 3, fair. Patient is able to raise the scapula off the table. The therapist may use one hand to check for scapular clearance. Thoracic rotation. Grade 4, good. Position of patient. Supine with arms crossed over chest. Position of therapist and all other aspects are the same as grade 3. Thoracic rotation. Grade 5, normal. Position of patient. Supine with hands clasped behind head. Position of therapist and all other aspects are the same as grade 3 and 4. Grading. Grade 5, normal. The scapula corresponding to the side of the external oblique function must clear the table for a normal grade. Thoracic rotation. Grade 2, poor. Position of patient. Supine with arms outstretched above plane of body. Position of therapist. Standing at level of patient's waist. Instructions to patient. And QUOT, sir, lift your head and reach toward your right knee. And QUOT, repeat to left side for the opposite muscle. Test. Patient attempts to raise body and turn toward the right. Repeat toward left side. Grading. Grade 2, poor. Patient is unable to clear the inferior angle of the scapula from the table on the side of the external oblique being tested. The examiner must, however, be able to observe depression of the rib cage during the test activity. Therapist palpates the external oblique first on one side and then on the other, with one hand placed on the lateral part of the anterior abdominal wall distal to the rib cage. Continue to palpate the muscle distally in the direction of its fibers until reaching the anterior superior iliac spine, ASIS. At the same time, the internal oblique muscle on the opposite side of the trunk is palpated. The internal oblique muscle lies under the external oblique, and its fibers run in the opposite diagonal direction. Examiners may remember this palpation procedure better if they think of positioning their 2 hands as if both hands were to be in the pants pockets or grasping the abdomen in pain. The external obliques run from out to in, the internal obliques run from in to out. Thoracic rotation. Grade 1, trace, and grade 0, 0. Position of patient. Supine with arms at sides. Hips flexed with feet flat on table. Position of therapist. Head is supported as patient attempts to turn to one side. One hand palpates the internal obliques on the side toward which the patient turns and the external obliques on the side away from the direction of turning. The therapist assists the patient to raise the head and shoulders slightly and turn to one side. Instructions to patient. Sir, try to lift up and turn to your right. Repeat for turn to the left. Test. Patient attempts to flex trunk and turn to either side. Grading. Grade 1, trace, the examiner can see or palpate muscular contraction. Grade 0, 0, no response from the obliquus internus or externus muscles. Diaphragm. All grades, 5 to 0. Position of patient. Supine. Position of therapist. Standing next to patient at approximately waist level. One hand is placed lightly on the abdomen in the epigastric area just below the xiphoid process. Resistance is given, by same hand, in a downward direction. Test. Patient inhales with maximal effort and holds maximal inspiration. Instructions to patient. Sir, take a deep breath, as much as you can, hold it. Push against my hand. Don't let me push you down. Grading. Grade 5, normal, patient completes full inspiratory, epigastric, excursion and holds against maximal resistance. A grade 5 diaphragm takes high resistance in the range of 10-0 pounds. 4. Grade 4, good, complete S maximal inspiratory excursion but yields against heavy resistance. Grade 3, fair, complete S maximal inspiratory expansion but cannot tolerate manual resistance. Grade 2, poor, observable epigastric rise without completion of full inspiratory expansion. Grade 1, trace, palpable contraction is detected under the inner surface of the lower ribs, provided the abdominal muscles are relaxed. Another way to detect minimal epigastric motion is by instructing the patient to sniff with the mouth closed. Grade 0, 0, no epigastric rise and no palpable contraction of the diaphragm occur. Intercostals. Position of patient. Supine on a firm surface. Arms at sides. Position of therapist. Standing at side of table. Tape measure placed lightly around thorax at level of xiphoid. Test. Patient holds maximal inspiration for measurement and then holds maximal expiration for a second measurement. The difference between the two measurements is recorded as chest expansion. Instructions to patient. Sir, take a big breath in and hold it. Now blow it all out and hold it. Grades. There are no classic 5 to 0 grades given for the intercostal muscles. Instead, a flexible metal or new cloth tape is used to measure chest expansion.